2020-21 was an extraordinary year for the NHS. It impacted on all of our lives, whether we or those closest to us contracted the virus, were furloughed, or suffered the isolation and loneliness of lockdown. We saw the unwavering dedication and commitment of our staff in doing their very best for patients, whether they were providing hands-on care or supporting clinical colleagues. Here are some of our achievements during a very turbulent year.
We introduced a new video conferencing system for patients in the hospital and our local community, so that our clinical staff could continue to meet face-to-face with patients and their families, while protecting each other from the risk of infection.
New software for our call center appointments ensured callers are now more quickly and efficiently connected to the person they need. The center, which handles more than 16,000 calls a month, is the main contact point for appointment queries.
Our health visiting and school nursing teams were amongst the first in the country to set up a helpline for concerned parents during the lockdown, which was praised by the Department of Education. The helpline provided help and advice to parents on a range of issues, from immunization to minor illnesses, and feeding problems to development needs. We were awarded a £3.6 million share of a £18.4 million package for Greater Manchester, to help hospitals upgrade their facilities and improve A&E capacity.
In 2020, the government pledged £30.6 million to fund a new emergency care campus on the hospital site. It is hoped that building work should start on the campus in 2021, and be complete in 2023.
Our maternity department took delivery of 10 innovative new baby lifeline bags to help midwives to support home birthing mothers. The bags contain standardized equipment in color-coded compartments to ensure midwives have everything they need quickly to hand for different stages of labor and birth, including emergencies.
We introduced the Cure project to help patients to stop smoking. The Greater Manchester-wide project aims to identify and help all smokers admitted to hospital, offering nicotine replacement therapy and specialist support to help patients kick the habit while in hospital, and stay smoke-free once discharged.
We welcomed a new state-of-the-art CT scanner to Stepping Hill Hospital. The scanner is used to identify signs of cancer, as well as other conditions such as blood clots, strokes, tumors, bone fractures and surgical emergencies.
10 nurses from India and Nepal joined the trust as part of our efforts to recruit and retain more staff. They are among the 41 international nurses who have made Stockport their home since January 2020.
Our rheumatology team set up the Fast Track Ultrasound Clinic, the first of its type in Greater Manchester, to improve the diagnosis of giant cell arteritis, which can cause blindness.
Our hospital decontamination unit, which ensures surgical instruments are clean, sterile and safe, retained its national certified standard of quality assurance from the British Standards Institute.
Our clinical simulation team was shortlisted in the Medical Education and Training category of the Royal College of Physicians Excellence in Patient Care Awards. They were nominated for the way they use simulated clinical environments, dummy patients, and the latest technology to provide important training for consultants, nurses, advanced clinical practitioners and healthcare assistants.
Specialist nurse practitioners Donna Davenport and Andrea Harris were presented a Queen's Nurse Award, which recognised the best in community nursing across the UK.
Lisa Goff, a specialist tissue viability nurse at Stepping Hill Hospital, was part of a team to receive national recognition for their efforts in increasing efficiency in wound care across Greater Manchester.
Doreen Dooley, a colorectal clinical nurse specialist, was shortlisted for a national award for the positive impact her leadership has had on bowel cancer patients and her colleagues.
Dr. M.K. Shashidhara, a senior specialty and associate specialist doctor, and administrator Angela Berry, were both honored at Health Education England North West's SAS Awards, which celebrate the best in educational support for SAS doctors in the region.
We were named as the safest general hospital in the country for emergency abdominal surgery in the annual report from the National Emergency Laparotomy Audit. We were one of 4 top trusts in the country for survival rates for emergency laparotomies and also the best general hospital, with 1/4 of the expected number of deaths according to national figures.
Nesta Featherstone, our Associate Nurse Director for Infection Prevention and Control, was presented with a National Cavalstar Award from the Caval Nurses Trust for her outstanding dedication and commitment during the pandemic.
Jack Butler, a chest reporting radiographer, received the InHealth Award for Academic Excellence in Clinical Reporting, Adult Chest Pathway, for being outstanding on the postgraduate certificate in clinical reporting course.
Our hospital catering service was chosen as one of just 14 exemplar sites for NHS catering across the country, and the only one in Greater Manchester. Exemplar sites are test sites for national initiatives, and support other services to raise the standards of NHS catering. Our catering team was singled out for its high standards of nutrition, and the diversity and choice it offers both patients and visitors.
Our corridors were brightened up with wonderful hand-drawn pictures from local children as our local communities gave thanks for the work of the NHS.
A room to provide a much-needed space of calm and reflection for staff was made all the more comfortable due to a generous gift of furniture from Macclesfield Furniture Store, Araghi Bianchi.
Our hard-working teams were hugely appreciative of the weekly clap for carers as well as masses of donations, including hundreds of Easter eggs, hand cream and hampers.
Thanks to mobile devices donated by solicitors firms Simpson Miller and mergers and acquisitions company Benchmark International, many of our patients were able to keep in touch with their families while in hospital during the pandemic.
Staff benefited from a new communal garden area, in which to recharge and relax thanks to Real Housewives of Cheshire star Dawn Ward, Manchester-based furniture company Dessa & Co and Swinton Insurance.
Stockport County Football Club was one of our first and most generous supporters during the pandemic, donating £95,000 for essential equipment. £12,000 of that funding has been used to buy a specialist medical treadmill to help our respiratory physiology team carry out key exercise lung function tests for patients with many conditions, including cancer and respiratory problems.
Endoscopy patients are benefiting from the generosity of local people who supported a 2-year funding for a new state-of-the-art scope guide. The equipment enables lower bowel procedures to be carried out more easily and quickly, and so improving patients' experiences.
Thanks to Charity Cradle, we took delivery of comfort bags to help support parents admitted to hospital who have lost a baby. The bags include essential items such as toiletries as well as notepads to write down questions or thoughts and a "Dear Friend" letter with details of how to access support from the charity.
NHS Charities Together donated £50,000 to support staff health and well-being initiatives. These included luxury Christmas hampers for our hospital and community teams, to thank them for their efforts over the last year. Our membership strategy includes regular checks to determine that we are actively seeking representation from all aspects of our local society within our membership, and seeks to engage with our members. Plans to deliver our strategy during 2020-21 were severely impacted by the pandemic, due to the limitations of social distancing, shielding, and staff focused on urgent operational issues. We did, however, circulate a members' newsletter 3 times a year, to highlight the latest news about our activities and share information on how members can contact their governor representatives. Update our website to share information about governors and how members can contact them. Share social media messages. Email updates about our activities, including briefings to our members during the pandemic.
In 2020-2021, we faced one of the most challenging years in the history of the NHS. We rose to that challenge, and we'd like to thank our dedicated, hard-working staff for their efforts, which continue to this day. We'd also like to thank you for your continued support.